The real reason your face looks puffy every morning. After 60, most people think morning face puffiness after 60 is just about sleeping badly or eating too much salt. And sometimes that is true. A salty dinner, poor sleep, alcohol, allergies or sleeping flat can absolutely make the face look swollen in the morning. But here is where people get fooled. If your face looks puffy almost every morning, especially around the eyes, cheeks or jawline, the real reason may not be one bad meal. It may be that your body is not moving fluid as efficiently as it used to. After 60, the face can become a mirror for what is happening deeper inside the body. Fluid balance, inflammation, kidney function, thyroid function, sleep quality, medication effects, blood pressure, and even the way your lymph system drains overnight can all show up in the face before you notice symptoms anywhere else. Now, this does not mean every puffy face is dangerous. Many causes are mild and fixable. But it does mean you should stop treating morning puffiness like only a cosmetic problem. Sometimes it is a body signal. The first thing to understand is that puffiness is usually fluid, not fat. Fat gain does not appear overnight and disappear by noon. But fluid can. That is why your face may look swollen when you wake up, then slowly improve after you sit upright, walk around, drink water and start moving. During the day, gravity helps pull fluid downward. But when you lie flat for 7 or 8 hours, fluid can shift toward the face, especially around the eyes where the tissue is loose and delicate. This is why many people notice puffiness under the eyes first. That sounds small, but it matters. Because after 60, your body's fluid control systems may not respond as quickly. Blood vessels can become less elastic. The lymphatic system may drain more slowly. Sleep may become more fragmented. Salt sensitivity may increase. And if you have high blood pressure, diabetes, kidney strain, heart issues, or thyroid changes, your body may hold on to fluid more easily. So the real question is not, why does my face look older in the morning? The better question is, why is my body holding or shifting fluid overnight? One common reason is salt sensitivity. Many people think they are not eating much salt because they do not use a salt shaker. But most sodium does not come from the shaker. It comes from packaged foods, restaurant meals, deli meats, soups, sauces, breads, frozen dinners, chips, pickles, and seasoning blends. After 60, some people become more sensitive to sodium. That means the same meal that caused no problem at 40 can cause puffiness, thirst, higher blood pressure, or overnight fluid retention at 65. This is where people get fooled. They eat what looks like a normal dinner, then wake up with swollen eyes and a heavy face. They blame aging, but the body may be reacting to the sodium load. A practical clue is timing. If your face is puffier after restaurant food, salty snacks, pizza, canned soup or processed meats, sodium is probably part of the story. The fix is not to panic or remove all salt. The fix is to reduce hidden sodium, eat more potassium-rich whole foods if your doctor says it is safe for you, and avoid making the saltiest meal your late dinner. The second reason is poor sleep quality, especially sleep apnea. This is a big one that most people miss. If you snore, wake up with a dry mouth, feel tired even after a full night, wake up with morning headaches or feel sleepy during the day, your puffy face may be connected to poor breathing during sleep. When breathing repeatedly pauses or becomes shallow at night, the body experiences stress. Oxygen may dip, pressure changes can affect fluid movement, sleep becomes less restorative. In some people, this can contribute to morning facial swelling, especially around the eyes. And this is why that matters more after 60. Sleep apnea becomes more common with age. Weight gain, menopause, neck size changes, nasal congestion and certain medications. Many people have it for years without knowing. They think I sleep 8 hours, so why am I tired and puffy? But time in bed is not the same as quality sleep. If morning puffiness comes with loud snoring, choking or gasping at night, morning headaches, high blood pressure, daytime fatigue or brain fog, do not ignore it. That is not just a beauty issue. That is a health signal. The third reason is allergies or sinus inflammation. Sometimes the problem is not fluid overload. Sometimes it is local inflammation around the eyes and sinuses. Dust mites in pillows, pet dander, mold, pollen, strong fragrances or even dry indoor air can trigger swelling around the eyes. You may also notice itchy eyes, sneezing, a blocked nose, postnasal drip or pressure around the forehead and cheeks. This is where people get fooled. They think allergies always mean sneezing all day. But some allergies are worse at night because you are close to the pillow, bedding, carpet or bedroom air for hours. By morning, the eyes look swollen and tired. A simple clue is whether puffiness improves when you change bedding, wash pillowcases more often, use an air purifier, treat nasal congestion, or sleep slightly elevated. If the puffiness comes with itching or sinus pressure, allergies may be playing a major role. The fourth reason is thyroid slowdown. This one is important because it can look like normal aging. When thyroid function is low, the body can become slower at managing energy, temperature, bowel movement, skin turnover, and fluid balance. Some people with low thyroid function notice a puffier face, especially around the eyes, along with fatigue, weight gain, constipation, dry skin, feeling cold, hair thinning, or brain fog. Most people miss this because each symptom seems small: a little tired, a little colder, a little heavier, a little puffier. But together the pattern matters. This does not mean every puffy face is a thyroid problem. But if morning facial puffiness comes with several slow body symptoms, it is reasonable to ask your clinician whether thyroid testing makes sense. The fifth reason is kidney or heart-related fluid retention. Now, this does not mean you should panic, but it is important to be honest. Your kidneys help control fluid, sodium, and waste. Your heart helps move blood forward, so fluid does not back up into tissues. If either system is under stress, fluid retention can show up in the body. Sometimes swelling appears in the feet, ankles, legs, hands, or around the eyes. Sometimes blood pressure rises. Sometimes urine changes. Sometimes fatigue increases. And sometimes early changes are subtle. This is where people get fooled. They look at a puffy face and only think about appearance. But if facial puffiness is new, persistent, getting worse, or comes with ankle swelling, shortness of breath, chest discomfort, foamy urine, reduced urination, sudden weight gain, or very high blood pressure, that needs medical attention. The face is not the diagnosis. It is the clue. The sixth reason is medication effects. Many common medications can affect fluid balance or facial swelling in some people. Certain blood pressure medicines, steroids, anti-inflammatory pain relievers like ibuprofen or naproxen, diabetes medications, hormone therapies, and some allergy or sleep medicines may contribute to swelling, dryness, or fluid shifts depending on the person. Do not stop a medication on your own. But if puffiness began after starting or increasing a medicine, tell your clinician. That timeline matters. Most people never mention facial puffiness because they think it sounds vain. But doctors need those clues. A change in your face can sometimes reflect a change in your fluid balance. So what can you do? Start with the simple things first. Try sleeping with your head slightly elevated. Reduce very salty dinners and late-night processed foods. Drink enough water during the day, but do not force huge amounts at night. Limit alcohol close to bedtime. Wash pillowcases often. Manage allergies. Walk in the morning to help fluid move. And notice whether puffiness improves after a few hours upright. Then look for the pattern. Is it worse after salty food? Worse after poor sleep? Worse during allergy season? Worse after a new medication? Does it come with fatigue, cold intolerance, constipation, or weight gain? Does it come with ankle swelling or blood pressure changes? That pattern tells the real story. And here is the key takeaway. Morning face puffiness after 60 is often not about your face at all. It is about fluid regulation, sleep quality, inflammation, hormones, kidneys, heart health, or medications. Sometimes it is harmless, sometimes it is fixable, and sometimes it is an early warning that deserves a closer look. So do not just cover it, ice it, or blame your age. Watch it, learn from it, track what makes it better or worse. And if it is persistent, worsening, or appears with other symptoms, get it checked. Because your face may be showing you what your body has been quietly trying to say all night. The mirror may show the puffiness, but the pattern reveals the reason.